Let's talk about nasal hygiene. This is the act of introducing fluid into the nasal cavity to flush out mucus and debris, blocking what normally would be open space for air to pass through. The fluid might be saline, otherwise known as salt water, a steroid rinse, or it could be one of those liquids with something added, something more natural like xylitol, or something more unnatural in some cases. Always check your ingredients. Sometimes people prefer to use a neti pot for nasal irrigation based on Ayurvedic practices. This requires a little more knowledge and technique, whereas a more family-friendly option might just be using a squeezy bottle or even simpler, a nasal mist or spray. I first learned about nasal hygiene when taking a breathing course offered by Dr. Jennifer Hobson of the Hobson Institute. I highly recommend her clinic to anyone in the Chicago area. During that course, we tried 2 different nasal sprays. I'll link both of these products below. These 2 brands seem to come up reliably recommended by many in the airway health field. Instructions for nasal irrigation involve introducing the liquid into one nostril and having it exit out the other. For a nasal spray, instead, you just introduce the liquid in one nostril at a time, but you actually swallow what passes through to the back of the throat. One of the advantages that I've heard about with the swallowing technique is that the cleaning solution actually arrives to the back of the throat, and it may pass over inflamed tonsils or adenoids in its journey, possibly having a positive effect on cleaning and reducing the size of the inflammatory tissue there as well. With this option, you'll want to tilt the head back a little bit instead of sideways, that you'll see the sideways position more commonly with neti pot users. Some experts recommend ongoing practices of nasal irrigation as a preventative health measure. Others only recommend it during a period of a few weeks to months at a time to bring down inflammation of the nasal passages. My non-scientific instinct here is just to recommend this technique while working to train nasal breathing habits over mouth breathing habits, or in periods where, maybe allergies are higher, or if you're trying to recover from some acute colds or things of that nature. In many cases, once nasal breathing becomes more of a habit, the nasal airway space tends to have less inflammation versus when one's still required to breathe through their mouth. A recent study published in Australia compared saline versus steroid intranasal sprays used 1 time daily for 6 weeks in children who had been diagnosed with sleep-disordered breathing. There was no difference in treatment effect between the intranasal corticosteroid and intranasal saline. Both nasal sprays resulted in resolution of symptoms in approximately 40% of participants. There have been some controversies about ongoing use of nasal irrigation. To dive a little deeper into the risks and recommendation on how to do nasal irrigation, I recommend going to the YouTube page of ear, nose, and throat doctor Stephen Park and watching his video called 7 Insanely Easy Ways to Unblock Your Stuffy Nose. In this video, he mentions some of the controversies as well as how to more safely select a nasal irrigation product based on saline concentrations and ingredients. He also commonly recommends the 2 products that I mentioned before. So if your child is snoring at night or you notice them breathing through their mouth, seems like a relatively safe and simple method to try first at home to introduce nightly nasal hygiene routines. If you're ready to take next steps and talk about your child's specific symptoms or begin to establish a local care team in your area, then schedule a consult with me and we'll get started. I can't wait to hear about how the nasal irrigation's been helping in the meantime. Thanks for listening.